Good evening, everyone. Good morning. Good morning to everyone here in Canada, US, and to the Philippines. Magandang gabi po. Good evening. So I'm broadcasting a few different platforms. Let me put this on silent. I'm broadcasting to a few different platforms. Hello to our friends, Global TV. Hello, Filipino Canadian Organization. Hello to Filipino Success Movement and to our group, Level Up Wellness Community. I will have to remove this later because I will be speaking mainly Taglish para po sa ating mga friends sa Philippines. So today is mainly Q&A. So Q&A po tayo ngayon, everyone who is in this wellness journey, welcome po. And I have prepared a few. Our team has looked at yung mga questions ninyo, comments ninyo, and we have chosen a few questions to answer. And so if you will have additional questions, I'll look at the comments mamaya and pull up some of the comments, mga questions, and then if I'm not able to answer it, just if you have any questions, put it there para po makita ng team namin and we will answer next time. So to begin, hello everyone who's here. Hi, Marlin, watching from YouTube. Hello, Ana Ferrer is here as well. Yeah, thank you. Nate Dax, thank you very much. You're learning a lot. Doing TMAD 3 weeks. Oh, nice. And lost 2 kilos. Wow. It's hard, but I can. Yeah, definitely. You definitely can. Okay, so Miriam, good evening. Yes, Sydney Hesong, good morning. Good morning po. Looks like nandito kayo sa North America. Ano po? So, saan po kayo, Miss Sydney? And Joyce Paines from Bulacan. Hello. Okay, so ito na po yung ating mga tanong from the last, I think the last few sessions, may mga questions that were sent in. So first question, Kate Almazan Agatep, mapagpalang araw. Mapagpalang araw din sa iyo po. So kapag po ba sinabing gluten-free, safe din po ba ito sa low carb? Ano po ibig sabihin ng gluten-free? Ang gluten and protein ay same lang. Okay, so that's a great question. And it's great kasi I know few people will have yung medical condition, yung celiac, yung tinatawag na celiac disease. So, napapanahon ito, this question is a good question dahil when someone has something like celiac disease, they cannot take anything na may gluten. So, ano ba yung gluten? So, gluten is a protein. So this is a protein that is present in specific types of grain. So for our purposes, yung grain na yun is, the most common is wheat. So why is that important and how does that relate to our low carb journey? So in fact, yung gluten-free, people who require a gluten-free diet are lucky. Kasi nga, if you are finding gluten mainly in wheat products, so wheat products, that's the main ingredient of our mga baked goods, the common things that we see in the market, unless it's labeled gluten-free, the usual flour, the white flour, all-purpose flour that we see in the market, white, it can be also the whole wheat type. So anything that's wheat will have gluten. And so itong gluten po na ito, is the common ingredient ng mga baked goods natin, all the usual high carb food items in the grocery. And so if you are going low carb and you know from our food guide, by the way, we have a new food guide. So please download the new food guide. Just go to either, if you're a member of Level Up Wellness Community, it will be there in the announcement section. So if you're not a member yet, please make sure to join. So Level Up Wellness Community, we always update. So to get the most updated information, you try to become part of the group because all of the updated resources are there. So get the food guide, the most updated one, in the community inside. So using that, you'll see that our recommendations really is to avoid avoid gluten products. So if you're going, gluten, whole wheat products. And so in this case, then if you're not eating grains like rye, durum, wheat, then you're avoiding gluten as well. So again, to answer Kay's question, where is Kay's question? So to answer Kay's question, gluten is a kind of protein that's present in certain grains. The most common grain that we see, and actually we're trying to avoid in our low carb diet, is wheat. So gluten is present in wheat. It is a protein that's present in wheat. And so if you're going low carb, you're avoiding eating wheat based products anyway. And so in that case, it's easier for you. So here on our stop, do not eat and drink, you will see here refined grains and products. So whole wheat is there and all its products. Whole wheat, the white flour, baked products. So it's going to be easier for you if you need to avoid gluten anyway. So that's the first question. So next question here. Cancer survivor. May hormones med ako tamoxifen. Kaso side effects, tumaba po ako kaya gusto ko mag-intermittent fasting. Hindi ko po sinasabi sa oncologist. So now for cancer, you have heard me talking about how going low carb is potentially beneficial for cancer patients too, and it's because we know that there's a relation between yung tumor cells and feeding on sugar, right? And so if you are not eating sugar a lot, you're potentially starving the tumor cells. So in this way, it's to give you just a very short background about it. I'll talk more about it in a different broadcast, but you're essentially starving it because when you're eating low carb, you're not really utilizing glucose as your main fuel, and so potentially starving yung cancer cells. So intermittent fasting, it's great anyway. It has so many benefits. If you missed my broadcast about benefits of intermittent fasting, please go to the Filipino Success Movement page or in YouTube. It's there. I gave you the 10 benefits of fasting. And it has so many other benefits anyway, in addition to this beneficial effect on certain types of cancer. So overall, you'll be getting lots of good things from intermittent fasting, even if you don't have cancer. But all the more if you're looking for optimizing your health mo, because when you have that condition, you really need to optimize your health. You need to increase your reserves. And so going low carb, doing intermittent fasting will give you really a lot of benefits. So it's still important to discuss with your doctor. Obviously, you need to work closely hand in hand with your healthcare provider. By itself, intermittent fasting should not be a problem because usually tamoxifen, you can take that with or without food anyway. So, and even for certain medications that you need to take with food, then you can take those medications when you are in your feeding window. So even if you're intermittent fasting, that's fine. So thank you for that question. Next question is Mai Lagasca. Is it okay to lose weight 1 kilo every 2 weeks? Di ba masyadong mabilis? I'm doing clean keto. That's great. And fasting 18 to 22 hours. So just to give you a bit of a background here, guys, again, I've given you this from my previous talk, but if you remember, we have this graph, right? So you see here, the arrows look at insulin stimulation. So anything that will increase insulin stimulation will be in the red part. Anything that will bring it down, because you remember, insulin is our main hormone, right? Insulin is the hormone responsible for fat production. So in those trying to lose weight, it's really the main hormone that you should look at and help you with regulating your metabolism. So here you'll see that the combination of the carbohydrate restriction. So when you are going low carb, a combination of intermittent fasting and exercising. So these three are actually more effective. So in this case, in the particular case of Miss Mai, I think, imagine she's doing clean keto. So clean keto will be less than 20 grams a day of net carbs. So really, really effective. And then she's adding fasting, 18 to 22 hours. So almost can be OMAD or TMAD, 1 meal a day or 2 meals a day. So certainly, as we see here, that combo is super effective, right? Super, super effective. Because if you add yung effect nila, right? Imagine you're adding both carb restriction and intermittent fasting, then for sure, you're really down regulating insulin stimulation, and of course it's more effective in making you lose weight. Now the traditional concept in medicine is the safe weight loss is around 2 pounds per week, but in this case, when you're losing, so in the initial phase of your weight loss, you're really mainly losing water, because remember our action insulin, it not only tells the glucose to get into the cell. So this is the primary action, but also it's the one that tells the cells to tells the glucose to deposit the extra fat in the liver in the form of glycogen. So itong glycogen po nito, it's bound to a lot of water. And so in the initial phase, when you are doing your intermittent fasting and clean keto, what happens is you're losing so much water when you are accessing and breaking down that liver glycogen. So most of the weight loss that occurs in the initial phases of yung intermittent fasting and keto is a combo. It's a combination. Yung combination na yun is mainly like water loss. So, a lot of people are encouraged about that. That's great. Now, if you keep going, eventually, you start accessing fat. Kasi the fat, like especially yung midsection, yung sa abdomen po natin, chan, bilbil, that's really hard to access. You need to go longer in your keto or low carb journey, plus your intermittent fasting to actually access that. So the initial weight loss, again, is mainly from water loss. And so that's why a lot of people would see, wow, so much weight, right? It's from the glycogen in the liver. So they're losing a lot of weight. And so over time, you will realize magpa-plateau din yan. It will reach a point depending on how much fat storage you're carrying. So if you have a long way to go, then it will continue. So as long as you are eating, that's why, guys, I always emphasize, when you make your plates, it has to be nutrient dense, right? So I gave you some guidelines again in the group. If you haven't joined the group, I gave you some guidelines. So join our group. In there, I've talked about how do you create properly a low carb plate. And I'm so happy. Actually, we have a specialist there, a chef, see Chef Ed Kawit. And he was saying, he liked my approach because of course, he's a specialist. He's a culinary specialist. And he's saying that it's good to be promoting nutrient-dense plates, even though we are going low carb, right? Because we certainly don't want any nutrient imbalances. This is why our guide, it's really a nutrition guide. It's a nutrition guide because it's not only, weight loss. We're not after doing weight loss just for the sake of losing weight. It has to be done in a healthy and safe way. And so, even though you're losing a lot of weight, because you're really like now fine-tuning yung hormonal signals sa body mo, but as long as you stick to a good, balanced, nutrient-dense plate, then you should be fine. So it's really, really important, again, to do it the proper way. You cannot be, of course, if you only eat lettuce leaf, you're going to lose a lot of weight, right? But is that safe? It's not safe. You have to have your protein. So I've given you a guide there how you can actually properly do it. You have to have your protein. You have to have your fat. Fats are still essential for absorption of certain vitamins and to help you feel fuller longer. And then, of course, you have your carbs. Although, again, carbs are not essential per se, but I recommend eating plant-based yung carbs, the sources of carbs, low net carb plants above ground because of the phytonutrients. So yung mga, it's very nutrient dense. There are certain things that you can only get from plants, sabi nga ni Chef. So yeah, so thank you for that question. Next question, we have, okay, so this question here, paano po ba pumayat? Hirap na hirap ako, may palpitations. Okay, so great question. First of all, as I always say, always make sure that you have had your medical checkup done. And this is to make sure that medical conditions are stable. So there are certain medical conditions. For example, in this lady's case, Miss Marisa, the palpitation may need to be addressed talaga first because it can be something that you'll need to take medications for. So, for example, a very common medical condition is atrial fibrillation. And so for that, your risk of getting something like a stroke is really high. So you need to get that palpitation checked up thoroughly and start the proper medication for it, whatever the diagnosis is. And once your medical condition is stable, and this is applicable across the board, once your medical condition is stable, whatever it may be, can be palpitation, heart disease, diabetes, whatever it is, once it is stable, then you get clearance from your doctor, then you can safely start the low carb regimen or intermittent fasting or a combination. Again, it's not ideal. It is not recommended that you start this journey with any unstable medical conditions. It's not safe. So please, if you have any symptoms that you haven't had your medical doctor check, have them checked it yet, then please, you have to get your doctor to check you first. So do the proper assessment, in-person assessment. They have to do a physical exam. Then they have to probably order some workup, so laboratory or ECG or whatever the case may be for your particular condition, and get a proper diagnosis, start the proper treatment. Once you get the clearance, medical condition is stable, then you can safely start your low carb intermittent fasting. In this platform, a lot of people ask me questions. Obviously, I cannot be a doctor to everyone, right? This is more an information-based source. So very important still have a medical doctor check you, okay? I want to provide you with proper information. So I'm not going to just say, okay, you start this without proper clearance. You always have to get that. That's why you see in my disclaimers, get proper clearance from your doctor. I cannot tell you specifically what to do in your particular case because I haven't seen you. You're not my patient. Except for my patients, sometimes they ask questions on my social platform. I can give them advice. I know their cases. But for most of the followers of the platform, please contact first. If you're relatively healthy, you don't have any medical conditions, then sure. But if you know that you have certain diseases and you haven't seen your doctor in a while, always check in with them first, okay? So thank you for your question. So next one here, let's have a look. And after this, I'll probably look at the comments and pull up some questions from there. Okay, Miss Shirley Guyana. Okay lang po 4 boiled eggs a day. 1 apple, substitute ko sa rice. I lose 4 kilos in 2 weeks. So the concept here of, so again, I would like to emphasize yung concept of nutrient-dense balanced meals. Of course, if you're only eating 4 boiled eggs a day and an apple and no more rice, you will certainly lose weight. And that's because 4 boiled eggs a day will give you 30 grams of protein. I'm not sure if you saw my visual. I have uploaded a visual. It's in the group, so join our community po. In the group, there is a visual there about protein amounts. So protein amounts in certain food, and this 4 boiled eggs usually will give you 30 grams of protein. Now, what is our requirement? What is a safe, again, we're trying to lose weight in a safe way. We need to know our requirement for each macronutrient. So what's the requirement? Protein really is the only truly essential because our body cannot make protein. So you need to eat protein. What is your daily requirement? So daily requirement, I always stress this in my posts, it's 1.2 to 1.7 grams per kilogram body weight. There are a few different ranges out there. I'd like to go by this because this is like moderate protein, not too high, to help us with our longevity, para humaba yung buhay. But it's also not too much. So I chose this range. This is the range promoted by a diet doctor as well. Because a lot of people in my community are also like me. They like to work out. So, when you're working out, you need to build, that muscle mass. So we normally go by the higher protein requirement. So anyway, back to yung comment, yung question na yun, 4 boiled eggs. So that's 30 grams, right? So imagine if you are 50 kilograms. So let's do this with me, okay? If you have a pen and paper, let's try to compute. So you learn, okay? So 50 kilograms, right? Let's say that's your weight, 50 kilograms ka. 50. So then if you go by the lower end of this recommendation, which is 1.2, so 50 times 1.2 is 60. So 60 grams ang requirement mo if you're a 50 kilogram adult. This is your protein requirement per day, right? So if you're only eating 4 eggs a day, that's giving you 30. Let's say yun si Miss, give me a moment. Let's say siya ay si Miss Shirley. Let's say Miss Shirley is 50. Then it's not going to be enough, right? It's not going to be enough for her. 30 grams lang yung kinakain yung protein per day. Yung kanyang requirement, her requirement is 60. So first off, that's a bit, there's a bit of an imbalance there. So konti yung kanyang protein, she's not meeting her requirement. And then she's only eating an apple. So an apple, small apple will give you around 12, depends on the source, the kind of apple, but around 12, 15 grams net carb per day. So certainly when it comes to yung range, she's in keto. If she's eating this every single day ganito, then she's meeting the keto threshold, right? If you remember, I showed you the different types of different degrees of low carb. I'm trying to find that. Okay, so this one, right? So Miss Shirley is certainly meeting the ketogenic, right? Because if she's eating 12 grams apple per day, right? So that's less than 20 grams. So she's certainly ketogenic. So talagang maglulose weight siya. But her protein requirement is not being met. And also, ano pa yung sinabi niya? Yeah. Then, of course, she's going to lose a lot of weight, right? She will. But again, the concept of keeping or eating nutrient-dense meals, balanced meals, hindi yun nami-meet. It's not being met. And over time, this will cause a problem. So please, yes, it can be effective, right? Very effective, but do it safely. So do it safely. Meet your protein requirement, number 1. Number 2, you have to have some fat. So, when you're only eating, there's still fat in the eggs, right? The eggs is a complete meal. Kumbaga, it has like fat, it has a bit of carbs, it has protein in there, but it'll be helpful if you have a little bit more. Like, let's say, you make a salad, you put some olive oil, so that's good fat, right? So, and then again, the concept of vegetables, right? So if you're only eating the fruit, that apple, you're missing out on a lot of like phytonutrients that you can only find in plants, specifically above ground greens. So really, really important. So hopefully you will, from now, you've already lost a lot of weight. So hopefully you can create more balanced, nutrient-dense meals because it's going to benefit you in the long run. So Miss Shirley, if you're watching this, please try to optimize your protein requirement for the day and add some more greens there. Keep it more balanced. Keep it nutrient-dense. So you're doing it in a safer way. Okay, so I'm going to stop with the questions. I have a few more, like 5 questions here, but what I'll do now is pull some questions from the comments. Let's have a look. Questions here. Okay, so Miss Nenen Onanikam, I think this is in reverse. Okay, thank you for your question, Miss Nenen. So you're 58 kilos, 49 years old. So if your medical conditions are stable, then you can start. How will you lose the weight? So you have like 5 kilos to go. It's not so much, right? It isn't so much. Certainly doable as long as stable medical conditions. The way you're going to do it is join our community. All the resources are there. So, ano po doon is you need to go step by step. So if you've joined our community, in the announcement section is the step. So once you get in, so please send your request to join the Level Up Wellness community. All the resources, how to start it step by step, is there, pinned to the top. So to the top of the page, you'll see in the announcement section the updated food guide. Make sure that you download that, because that's going to be your resource for when you're shopping and creating your meals. Number 2 is the step-by-step guide. And it's again on top, pinned on top ng recommendations doon, announcement. So please join our community, Ms. Nenan. So I'm just gonna flash it again here kasi nandun po yun lahat. I've explained it very, very like detailed there. Okay? So next question here, tingnan natin. Miss or Mr. Badria Salipada. Hello, Doc. 82 kilos po ako. Nahirapan ako mag-diet. Mag-iisang buwan na po ako. No rice. Puro eggs at gulay. Kaya lang minsan kumakain ako ng 5 eggs. At dadagdagan ko ng gulay, 1 meal lang po ako sa isang araw. Okay, so this is a great insight. Thank you very much for sharing this. So first of all po, the thing is, it's great that you've already given up rice. That's a great first step. Among Filipinos, this is the staple high net carbohydrate. So that's great. For other people, it's usually like bread. So in your particular case, it's great you've already given up the rice. Now, the question is, ask yourself, sir or ma'am, if is it only rice that's causing, is it only rice that's in your high net carb kind of food choices, right? And so it's really important, sir or ma'am, if you haven't downloaded itong guide natin, please download. So there's a newer version of this. Now, again, this guide is to be downloaded for free. Meron din PDF. If you ask our team members, we can send you the PDF for a clearer copy. But what it will give you is itong, give me a moment, let me remove itong comment. So what it'll give you is itong part na ito, right? Itong stop, do not eat or drink. So sir, good question to ask yourself. Are you still eating some of the things that are listed in the stop section, yung red? Because if you are, then you really need to, it's not only the rice, you have to start really looking at all the other food items that are on your plate on a day-to-day basis that belong dito sa red na ito. Because if you're still eating these things that are in the red section, it'll be very hard for you to actually lose weight. Why? Because the insulin stimulation keeps going on. So insulin, so for example, if you're, let's say, you've given up, you're on a diet, no rice, but you drink a lot, for example. I don't know your particular case, but I'm just giving you. So, kasi alcohol, it needs to be burned first. So it's gonna cause some weight loss stall. So mahirapan ka talaga mag-burn if you're drinking and you think that you're doing low carb or you've given up rice, but in reality, you still have other things in your diet that's stimulating insulin. So be very, very thorough in reading. Pakibasa pong maigi. Be very thorough. Talagang what do you call that in Tagalog? Suyurin, or anyway, look at it thoroughly. Basahing maigi yung guide. Meron pa ba dito? Is there something here that I'm still eating that's stimulating boss insulin, right? That I have to give up. Because if you're still doing that, then it'll be really hard to lose weight. So thank you for that, Mr. Badria. So again, sir, the answer to your question is, it's great, continue to not eat rice, but look at the food guide, ask yourself, am I still eating something here in the red section? And then also look at the timing. You're saying here, isang meal sa isang araw, so you're OMAD already, that's great. So really just look at the other possible insulin stimulants in your diet. And then also the other thing is maybe there's a medical condition here. So some people with, let's say, hypothyroid will really have a hard time losing weight until the condition is stabilized. So again, another thing would be to check in with your doctor. So thank you for that. Now, let's have a look. Next comment. So, okay, this is a great one. Eileen Suyat. How long we should do the LCIF? Is it bad to do it longer? I'm currently doing this. It helps me a lot, especially watching your videos. And thank you for the advices. Thank you, Miss Eileen, for appreciating. So, Miss Eileen, LCIF is actually a lifestyle. So that's a great question po. Ano? It's not something that you do perhaps initially. You can do it in a more intense way. So what do I mean by that? You can go, so the low carb part, you can probably do keto. So when you're just starting out in your journey, and let's say you have a medical condition that you really want to reverse, and you want to do it fast kasi medyo ano siya, it's really affecting your health, or you have a lot of weight to lose and you really want to just jumpstart your journey and you want to go really like you want to do it in a faster way, then you can do the more advanced form, or yung parang mas potent form, which is keto, for example, right? Less than 20 grams. And then you can do, in terms of the intermittent fasting, you can do, let's say, OMAD. So the combination of keto, so less than 20 grams, and then OMAD, you can do that initially pag mag-start ka pa lang. Ngayon, once you reach your goal, so this is for all those people in our community who've already reached their goals. Once you've reached your goal, so for example, my good friends, Team Fortaleza, so si Inday G and Chef Jomar, they're already maintenance phase, right? So they're already just maintaining. They've already reached their goals, reversed their medical conditions. Now, are they going to stop the lifestyle? But because they've already reached their goal? No, because if you stop it, then mag-yo-yo ka. This is what we're talking about all the time. You will go back. Because the tendency with these high carb meals, as you know, it really prompts you to keep eating, right? Because when that carb, when that sugar dip happens, you're hungry again. So in this case, Ms. Eileen, this is a lifestyle. Once you've already achieved your goal, then you just maintain it. You can be less, you can choose a less potent na, or less extreme kind. So for example, if you were doing keto before, then you can transition to moderate low carb. So that's 50 grams a day. So again, you can vary the degree depending on if you've already reached your goal. So once ma-reach po ninyo ang goal ninyo, mag-maintain na po kayo. Ibig sabihin, you don't have to give up. It is a lifestyle. So LCIF is a lifestyle. It's not something that you do for 5 months lang, then tapos na, babalik ka na sa high carb. Mangyayari niyan, lahat ng mga advantages na nakuha mo will return. Will be offset. So the previous medical conditions are going to come back if you go back to high carb lifestyle. So that's what I can say about it. It is a lifestyle. It's for life. You can vary the degree. You can go less. You can go like moderate low carb, or you can shorten your fasting and just maintain. Okay po. So hopefully you answer the question. Okay, so maybe one last question and I'll join you again in 2 days. By the way, guys, for everyone who's interested, so I know that a lot of you have already given your testimonies. Many people in our community have already started to reverse their medical conditions or have lost weight. So our group is actually only 1.5 months old, but we're already seeing some results from group members. For those who want extra guidance, because some people have more questions than others. And if you want extra guidance, and if you're also into, like me, into exercising and you want to have extra guidance, you need to, talk to me on a more regular basis, then we have our wellness program po coming up. So wellness program. So it is more like it's a guided program. So we're releasing that on the middle of June. So June 15th is the release of that program. If you want more guidance, you need to have some idea about certain recipes. you need to have a more in-depth training on low carb and intermittent fasting. You want to have access to exercises. You want to have access to a coach. We have a coach in that program who will help with the fitness part, the movement part. Then we're giving special discount po para sa mga gusto mag-avail. And I'll put out the link. We're releasing the program on June 15th, and everyone who will pre-register will have a discount. So please stay tuned for that announcement. This is only for the people who want extra guidance. Okay, the others who are already doing fine, certainly we have so many free resources po in our community. So you can join the community as well for that. Okay, so one last question, okay? And then next time I'll join you again. Oh, good evening daw from Turkey. Hello, Miss Beth. Thank you for watching. Hi. Okay, here. So Miss Melodina, okay lang po ba everyday ang fasting? 6 p.m. dinner ko, then 12 noon. Kung hindi pa ako gutom, nag-extend ako while fasting. I drink black coffee with lemon in the morning, then water with salt. Yeah, so 5'7", she's 5'7", oh, she's a tall lady. Weight goal is 65, she's 69. So 82, wow. So before she started low carb, she was 82. Wow, good job. Congratulations. So you've already lost 13 kilos. Very nice. And you have 4 more to go. Yeah, so everyday fasting is safe to do. As long as, yun nga po, again, emphasis on nutrient-dense meals, nutrient-dense meals. If you're only doing OMAD, it's really normal to not feel hungry. If you're already doing low carb for quite a while, you will notice a few members nagsabi rin na, I don't really feel hungry anymore. That's actually a natural consequence of going low carb because you're no longer relying on glucose for fuel, right? As long as you're relying on glucose for fuel, you're always kind of, you're hungry all the time. But once you start burning fat, so in this case, like what's happening here, once you start burning fat, and you're fine-tuning your hunger signals, you will no longer feel hungry. So it's okay to continue with the fasting. In any case, naturally, we're always fasting, right? You don't know it, but we're always fasting. Imagine when you go to bed at night, you don't eat the whole night when you're asleep, right? You're not eating while you're sleeping. And then when you wake up, and depends because breaking the fast can be done at any time. It doesn't have to be in the morning. You can break your fast, like in this case, 12 noon. That's okay. That's still breakfast, right? It's just a different time. So when you're no longer feeling hungry all the time, then you will find that your body doesn't need to eat and you can extend your fast. So theoretically, you're already doing fasting anyway. Every time you sleep, then you wake up the next day. That's a long fast, right? That's a good how many hours. And so when you're doing intermittent fasting, you're just simply extending the timing of the fasting. It can safely be done every day po. Just keep in mind that you are eating your nutrient-dense meals, okay? Nutrient-dense, again, follow our guide. If you haven't joined our community yet, please join our community. The guides are all there. Food guide, how do you create a low-carb meal? Other special, like important tidbits of information are there. So join our community. So that's it. I'll join you again. Please just put in your questions there. We will pull up your questions for the next broadcast. So I'll see you again soon. And for my FSM family, Filipino Success Movement, my success mindset driven family, we have a special guest. So Friday po, stay tuned. It's a special guest. I'm very excited. We're going to talk a bit about the success mindset. Okay, so that's on Friday. Watch out for the announcement for that. Okay, that's it. And stay healthy and stay low carb. Okay, bye for now.